Hello everyone. Diabetes mellitus, popularly known as sugar disease. Now what happens in diabetes is blood glucose level increases. Let us understand about glucose. Now glucose gives energy. We take food, carbohydrate, which get digested and releases glucose in the stomach. Glucose moves from the stomach to blood circulation. Now the job of blood is it circulates to the entire body and releases glucose to each and every cell. But this is possible only with the presence of a hormone, insulin. Now the job of insulin is it moves glucose from blood to cells. Now in diabetes, the patients will have either reduced insulin secretion or cells become less sensitive to insulin. Because of these two factors, what happens? Glucose remains in the blood. That means glucose concentration increases in the blood. Technically, it is known as hyperglycemia. Hyper excess, glucosemia, blood. In the blood, glucose concentration is more. What is more? What is normal? 90 to 120 milligrams of glucose per 100 milliliters of blood is normal. All the time in the blood, that amount of glucose need to be there. The reason is brain is completely dependent upon glucose for energy. 20% of body energy is consumed by only our brain. So brain is solely dependent upon glucose to get its energy. Now in diabetes, so glucose levels are increasing. So to treat this condition, certain patients will take insulin injection. What happens when they take insulin injection? They are directly taking insulin hormone. So that immediately moves the glucose from blood to cells. Understand this. What happens is, if someone takes insulin, glucose is moving from the blood to cells. So glucose concentration in the blood is going down. But it should not go below than 90 or 80 mg of glucose per 100 ml. If it happens, they get into a condition called as hypoglycemic shock. Hypo, less amount, glucose, emia, blood. So in the blood, glucose levels have completely gone down. That results in a shock that is called as hypoglycemic shock. As I told you, the major organ affected is brain. So the symptoms when the glucose levels are going down, the subject will have increased sweating, increased heart rate, and mental incoordination will be there. They cannot talk properly. That results in hypoglycemic shock. If that continues, it may lead to coma also. Dangerous situation. Now when this happens, how should we avoid it? When people take excess dose of insulin, this problem will come. Or when they take insulin injection, immediately after that 10 to 15 minutes they need to take food. If they don't take food, hypoglycemic shock will occur. Now if it happens, how to treat it? If the subject is awake, if he can talk properly, then give him dilute glucose solution. Add glucose to water, give it to him. Or give him a chocolate which contains a lot of carbohydrate which is converted to glucose. If his subject is not awake, immediately he needs to be admitted into hospital. Thank you.